Hi everyone, welcome back. My name is Hina Mazarudin and I am your Vice President for PAs in Virtual Medicine and Telemedicine. Today I'd like to continue the series that mirrors and complements our educational webinars that we do for our PA students to share and shed some light on real-life examples of how PAs utilize telemedicine in their respective fields. My intention is that this serve as an opportunity for us to highlight our amazing members, but also to connect and serve as an introduction so that we can all learn from each other. You know that I believe that we are stronger together. So without further ado, let's get started. Hi everyone, welcome back. Thanks so much for joining us. Today I'd like to introduce you to an amazing PA who is doing a very unique specialty and is utilizing telemedicine in that specialty. Allow me to introduce you to Jonathan. Hi Jonathan, how are you?
Hi, I'm well. How are you doing?
Doing fine, thank you. Jonathan, can you start by stating your name, how long you've been a PA for, and what area of medicine you practice in?
Yeah, so my name is Jonathan Baker. I've been a PA for 11 years, and I started out my career in infectious diseases for about 5 years, and then I moved to New York and worked in colorectal surgery. And in colorectal surgery, I've got to sort of combine my previous experience and current experience and end up doing colorectal surgery with sort of a focus on infectious diseases and sexual health. So things like HPV and sexually transmitted infections, and created sort of my own specialty.
That's amazing. And then can you share with us, Jonathan, about your experience with telemedicine with all of this?
Yeah, so we're in New York City, which of course got hit hard and fast last March. And one day we were like, oh, I guess we should get some more hand sanitizer. And the next day we were like, all right, we're closing. Um, and and we have a huge panel of patients and thought like we need some continuity of care. And the last thing we want is our patients who have maybe like some hemorrhoids or like something really benign to go to an emergency room where everyone's there for COVID and close quarters. And so we really quickly had to implement some telemedicine. And I was really lucky because I'm involved with a lot of PA organizations and connected with PAs in virtual and telemedicine, as well as a couple of other organizations like AAPA and New York State Society of PAs, and sort of pulled all my resources that I had. And from my infectious disease career, I was pretty familiar with like the CDC and DOH, and I ended up basically pulling together a template of how our office was going to pivot over to telemedicine when we had to. And so we have a practice manager. I work with two surgeons, but I was really the one that came up with the protocols. I came up with the way we're going to consent patients, what our physical exams would look like, and implemented that for our practice. And then we used it for about 6 weeks while we were closed. And we now have a little bit of a hybrid, although, of course, it has limited utility because we can't quite do, endoscopic exams through telemed, although I would love to.
Who knows? That may be the next thing with all these advancements that are coming down the pipeline.
Right? You have like your home stethoscope, your home blood pressure kit, and your home like endoscope.
I don't know, Jonathan. I think you may be onto something here.
You heard it here first.
That's right. All right. Can you share with us kind of what you like about telemedicine and what you think is more of a challenge, please?
So there's a couple of really huge benefits. There's actually a ton of huge benefits to telemedicine. And for me, one of the biggest is that we serve a largely sexual and gender diverse population, like gay, bisexual, transgender, and patients who have often faced discrimination by healthcare providers, who've often actually been refused care, and who often don't have access to the care that they need. And so one of the great things about telemedicine is we sort of expanded our reach, and I've had telemedicine encounters across state lines, which has all of its own complications, as you know. But I've been able to see patients in rural parts of California, and these are previous patients who are traveling. But it's really cool to have that niche of medicine that maybe patients don't have access to in other places, and be able to provide that to them. So that's been the thing that I really love. The challenge is, of course, in my field, I depend so much on physical exam and really particularly an anoscopic exam. And there just really is no way of doing that. It did I did have this sort of cool feeling in the 6 weeks where I was doing it frequently of like, wow, my history skills are so much better now, because I'm relying on history so much more than physical exam, which had always sort of been my standard in the field. Um, so those are the two things that I really like about telemed.
Awesome, thank you. And then can you share with us a clinical pearl or some kind of words of wisdom with our PA students and our fellow PAs, please?
Yes, I would love to. I think the thing about telemed that stood out the most to me, and I sort of alluded to this earlier, was I have this whole practice, and anyone in that practice could have come up with what our telemedicine plan was. But I grabbed the reins and ran with it. And I'm totally biased, but I think it did a great job. and and my employer certainly recognized that. And so this isn't specific to telemed, but I think, never underestimate the power of your education, training, and knowledge. PAs are really were to quote one of my mentors, somewhere between a stem cell and a 3D printer. We are so versatile, and to come up with that telemed plan was like right in my skill set, and not really connected to anyone else in the office. So always think about how you can be an innovator, how you can be versatile, how you can be flexible, and use that skill that is almost unique to PAs in medicine, to just be a great provider.
Thank you so much, Jonathan, for sharing those words of wisdom. And thanks everyone for watching, and we look forward to connecting with you soon. Take care. Bye.